At Western Reserve Hospital, we strive to meet 100% of our patients' needs 100% of the time. As an inpatient, patients often feel anxiety and fear around what may follow their hospital visit. This video is designed to provide proper instruction on the do's and don'ts specific to the bedside case management rounding process. This process not only helps staff communicate effectively with one another, but also demonstrates to patients and their families that their caregiving teams are all on the same page. Before we show you the process, there are a few things to ensure success which need to happen before the bedside case management process takes place. Prior to bedside case management rounding, during hourly rounding, the RN will inform their patients that they can expect the discharge planning team to go over their plan on 3 West from 10 a.m. to 10:30 a.m., 2 West, 10:30 a.m. to 11 a.m., and ICU, 11:30 a.m. to 12 noon. These rounds, ideally, will include representatives from case management, nursing, nurse practitioners or residents, therapy, and in some cases, respiratory and physicians. The goal of the bedside case management rounds is to provide a brief description of the patient's current stay status and next steps. Staff involved should be familiar with the points shown prior to entering the room. Information given at the bedside should be clear and concise, not lengthy or rambling. In the next scene, let's take a look at what the ideal bedside case management rounds would look like in each area.
Good morning, Mrs. Jones. My name's Melody. I'm your case manager here on the floor today, and I'm going to lead the discussions today about your discharge plans. Our goal is to help you understand what the next steps are in your care, and we'll be happy to answer any questions at the end of our rounds. Does this sound okay with you?
Yes, go ahead.
Okay, your admission status is inpatient, and we're going to hear a report from your nurse next.
Mrs. Jones was admitted on January 18th following her surgery. She is progressing well. She has an MRI scheduled this afternoon, followed by physical therapy. She had no unusual events overnight.
All good news. Thank you. Therapy?
Mrs. Jones is ambulating 50 feet with a wheeled walker and minimal assistance. We would recommend a skilled nursing facility for further therapy upon discharge.
Social services?
Mrs. Jones, you and I talked yesterday, and your 2 preferred skilled nursing facilities were Health One and Ace Health. Are those still your preferred facilities?
Yes, they are.
Wonderful. We'll continue to work on those plans today.
Okay, thank you.
Great. Well, please feel free to write any questions down for us. Utilize your call light if you need something urgently. Is there anything we can do for you before we leave?
I'm good, thank you.
All right. Your nurse or CTA will check on you within the hour.
Okay, thanks.
Thanks. Good morning, Mr. Smith. My name is Melody. I'm your case manager representative here on the floor today, and I'm going to help with the discussion about your discharge plans. Our goal is to help you understand what the next steps are in your care, and we'll be happy to answer any questions at the end of our discussion. Does this sound agreeable to you?
Yes, go ahead.
Great. Mr. Smith's admission status is observation, and let's hear from your doctor, Dr. Johnson.
Thank you, Melody. Mr. Smith was admitted on January 18th for dizziness and general weakness. As discussed a few days ago, he is on track for discharge today.
Thank you, Dr. Johnson. We'll hear from Zach, your nurse.
Thank you, Melody. Mr. Smith has been progressing very well. He has a CT scheduled for early this afternoon and has no unusual occurrences overnight.
Great. Thank you, Zach. Ashley from therapy.
Mr. Smith is progressing very well with physical therapy. He is ambulating 50 feet with a wheeled walker and minimal assistance. We would recommend follow-up with therapy and home-with-home health care is appropriate.
Thank you, Ashley. Mr. Smith, we talked to you yesterday about home health. Does that plan still sound good to you?
Yes, it does.
Wonderful. Social services, do you have anything to add?
Nothing to add at this time.
Great. Well, please feel free to write down any questions for us and utilize your call light if you need something urgently. Is there anything we can do for you before we leave?
No, not at all.
Great. Thank you, Mr. Smith. Your nurse or CTA will check on you within the hour.
Hi, Miss Brown. Hi, my name's Dr. West. I'm the ICU doctor in the ICU today, and we're going to start our case management rounds. and we're going to kind of stand outside the door because we have a big group and just kind of talk about your case. If you have any questions, you feel free to ask after rounds, okay?
Yes, thank you.
Thank you, doctor.
Nursing?
This is Miss Brown. She's a 49-year-old female that came in on the 22nd of January with chest pain. She is alert and oriented, not wearing any restraints. She's on 2 liters nasal cannula and hasn't brought up any secretions. She has been sinus rhythm for me. Vital signs are every hour and they've been stable. She voids and her urine output's been good today. She's got 2 peripheral IVs and normal saline running at 75. She's on a cardiac diet and her last bowel movement was 2 days ago. PT has not worked with her yet. She doesn't have any wounds. Her troponin was a little elevated, so we are going to check that in about 6 hours and then also get an EKG. She's also going to have an echo done today. We didn't hold any meds and there haven't been any social issues or family issues.
Thank you. Respiratory?
No issues. She's on 2 liters. We'll try to get her weaned down to room air today.
Thank you. Physical therapy?
We are planning to evaluate today.
Thank you. And case management?
We anticipate she'll go home without any further assistance.
Okay. We'll check another troponin this afternoon, and she's likely transferred to the floor.
Of course, not every patient interaction is as ideal as the ones we've demonstrated for you. In special situations where the patient may be in isolation, is confused, or irritable, it is acceptable to perform bedside case management rounds in the doorway. When taking this approach, however, be mindful of your tone of voice, volume, and other environmental factors.